generally speaking, we would talk about a biologic drug with a combination chemotherapy platform. FOLFOX or FOLFIRI are very dyed-in-the-wool standards at this point. And so generally speaking, we treat to a maximum response. The maintenance studies have kind of varied with how long patients are on treatment, 3 months all the way out to 6 months. And then generally there's some lightening or modification of the intensity of the chemotherapy to try to maintain that benefit for as long as we can. I think what the best maintenance therapy is for a particular patient, depending on what their frontline regimen is still not clearly defined, at least with crystal clarity. Some patients would argue it's a fluoropyrimidine alone, or some thought leaders, pardon me, would argue it's a fluoropyrimidine alone. Others would argue it's fluoropyrimidine and a biologic. Patients that are treated with an EGFR agent in the frontline setting, there's some thought that it could be continuation of the EGFR agent alone until patients have progression. And I think there's also some debate about what constitutes enough progression that you then need to transition on to second-line therapy. I think a lot of things go into play there, not necessarily just how patients doing radiographically, but how they doing clinically, where's the progression, are they symptomatic, asymptomatic? There's a lot of different features that go into that decision.